Have you ever wondered if there's a natural way to lower your blood sugar, protect your nerves, and stop diabetic complications before they start? Because in this video, you're going to discover the top 3 essential vitamins that every diabetic should take daily, vitamins that can help you stabilize blood sugar, improve insulin sensitivity, and protect your eyes, kidneys, feet, and even your heart from long-term damage. And here's the promise. If you stay until the end of this video, I'll reveal the one vitamin that most diabetics completely overlook. It's not even part of the usual diabetes conversation, but it could be the key to reversing years of silent damage and preventing the next blood sugar spike. Most people with type 2 diabetes are told that they need to focus only on diet, exercise, and medication. But here's what no one tells you. If your body is chronically deficient in certain vitamins, no amount of healthy eating or blood sugar monitoring will protect you from the complications that can quietly destroy your quality of life. We're talking about nerve pain, vision loss, kidney failure, and even amputations, all linked to vitamin deficiencies that are shockingly common among people with diabetes and prediabetes. And yet, no one is warning you about it. This is not your fault. Most doctors are trained to manage symptoms, not address root causes, and that's exactly why today's video exists. So let's get started with the first vitamin every diabetic should take daily, especially if you want to control blood sugar and protect your nerves. It's vitamin B6. Now you might be thinking, isn't that just a basic B vitamin? What makes it so important? The answer lies in something called diabetic neuropathy. If you've ever felt burning pain, tingling, numbness, or weakness in your hands or feet, there's a high chance your nerves are being damaged by high blood sugar. But here's the critical part. Vitamin B6 is one of the most important vitamins for nerve health. It helps create neurotransmitters, the chemical messengers that your brain and body need to communicate. And without enough B6, your nerve signals can become erratic or even stop completely. Even worse, studies show that people with diabetes are significantly more likely to be deficient in B6. Why? Because elevated blood sugar can cause your kidneys to flush out water-soluble vitamins like B6 faster than normal. That means you lose more of it in your urine every day, and that leads to a dangerous cycle. The more deficient you become, the more your nerve health deteriorates, and the more damage that accumulates silently over time. But when you replenish vitamin B6 consistently, the results can be life-changing. It supports healthy nerve function. It reduces inflammation in the peripheral nervous system. And it can even help improve insulin sensitivity, making it easier for your body to use glucose properly. That's why vitamin B6 isn't just a supplement. For diabetics, it's a daily necessity. So how much do you actually need? The recommended daily intake for adults is around 1.3 to 2.0 milligrams per day, depending on age and gender. But for people with diabetes, many experts suggest slightly higher doses, especially if symptoms of neuropathy are present. Now here's a warning. Too much synthetic B6 from supplements can cause toxicity over time. So make sure you're not megadosing unless you're working with a qualified health professional. Look for balanced B-complex formulas or food-based supplements that include B6 in safe amounts. But let's say you prefer to get your nutrients from food. The best food sources of vitamin B6 include salmon, turkey, chicken breast, bananas, chickpeas, spinach, and fortified cereals. These are excellent ways to support your blood sugar control and nerve health naturally. So to recap, vitamin B6 helps protect against diabetic neuropathy. It improves nerve function, it supports insulin sensitivity, and it's often deficient in people with high blood sugar levels. That's why it's the first essential vitamin on our list. But we're just getting started, because the next vitamin on the list doesn't just help your nerves. It helps protect your entire cardiovascular system from the oxidative stress caused by chronically high glucose levels. In a moment, we'll reveal the second vitamin. But before we do, let's talk about why this video could be the turning point in your diabetes journey. If you've ever felt confused about supplements, if you've been overwhelmed by conflicting advice, or if you've silently wondered whether there's more you could do to protect yourself from the long-term effects of diabetes, then this video is your roadmap. Because we're not just talking about controlling blood sugar in the short term, we're talking about reducing A1C levels naturally. We're talking about preventing complications. We're talking about reclaiming your energy, protecting your organs, and feeling in control of your health again. And it all starts with giving your body what it actually needs to function. That's the power of these 3 vitamins. In the next section, we'll reveal the second essential vitamin for blood sugar control, and why it's considered one of the most powerful antioxidants for diabetics worldwide. But first, a quick reminder. If you're finding this video helpful so far, make sure to give it a thumbs up and leave a comment below sharing your biggest struggle with managing blood sugar. And don't forget to subscribe, because we release new videos every week with natural, science-backed solutions to help you fight type 2 diabetes and win. Ready for vitamin number 2? Let's keep going. When your body lacks vitamin B6, it disrupts glucose metabolism and impairs the way your body breaks down carbohydrates. This is especially dangerous for people with type 2 diabetes because their insulin sensitivity is already compromised. Studies have shown that low B6 levels are directly linked to increased inflammation, nerve damage, and higher blood sugar levels. This is why so many diabetics experience tingling in their hands and feet without knowing the real cause. Vitamin B6 helps protect your nerves by supporting the synthesis of neurotransmitters and improving the health of the myelin sheath. This is the protective coating around your nerves that often deteriorates in diabetics. But it doesn't stop there. B6 is also essential for red blood cell production and cardiovascular health. Many diabetics are at increased risk of heart disease, and vitamin B6 helps reduce homocysteine levels. High homocysteine is a known risk factor for heart attacks and strokes. Now, let's talk about the right dosage. Most studies suggest that diabetics benefit from taking between 2 to 10 mg of vitamin B6 daily. But in some cases, higher therapeutic doses are used under medical supervision. Always talk to your doctor before increasing your intake. You can also get B6 from natural food sources. Foods rich in B6 include salmon, chicken breast, turkey, bananas, spinach, and potatoes. These foods are great for balancing blood sugar because they also contain fiber and other essential nutrients. Let's move on to vitamin E. This is one of the most powerful antioxidants available, and it plays a critical role in diabetes care. Diabetes causes oxidative stress, which means your body has too many free radicals and not enough defenses to neutralize them. This stress damages blood vessels, organs, and nerves, and it accelerates diabetic complications. Vitamin E protects your cells from this damage. It shields your arteries, reduces inflammation, and slows the progression of diabetic neuropathy. That means less pain, less numbness, and better quality of life. And there's more. Vitamin E also improves insulin sensitivity. Some studies have shown that it enhances the way your cells respond to insulin, helping to lower fasting glucose and improve A1C levels. If you're struggling to lose weight or keep your blood sugar stable, this can make a massive difference. Another benefit is how vitamin E supports eye health. Diabetics are more likely to develop diabetic retinopathy, which can lead to vision loss. Vitamin E helps protect the tiny blood vessels in your eyes from breaking down. Let's talk dosage. The recommended dietary allowance for adults is around 15 mg of vitamin E daily. But some therapeutic protocols go higher, up to 400 IU, especially for combating severe oxidative stress. Always check with your healthcare provider. Natural sources of vitamin E include almonds, sunflower seeds, hazelnuts, avocado, spinach, and olive oil. Adding these to your meals is a delicious way to support your blood sugar and protect your organs at the same time. Let's pause for a second. If you've ever felt like you're doing everything right but still can't get your blood sugar under control, don't blame yourself. Many diabetics are unknowingly deficient in these key vitamins, and without them, even the best diet or exercise plan can fall short. That's why understanding this is so powerful, because it gives you back control. You don't have to live in fear of spikes, crashes, complications, or confusion anymore. You just need the right information and a plan that works with your body, not against it. And that's exactly what we're building in this video. In the next part, we'll reveal the third essential vitamin that every diabetic should take. This one supports your immune system, boosts energy, and even helps heal wounds faster. You don't want to miss it. But remember, consistency is key. Taking your vitamins for a few days won't fix your blood sugar. It's the long-term commitment that rewires your system, heals your body, and makes a real difference you can feel. Keep watching, because at the end of this video, I'll share a bonus tip that ties all of this together and shows you how to supercharge the results of these 3 vitamins without changing your diet or exercise routine. It's simple, but it works. Let's talk about the third essential vitamin every diabetic should take, vitamin C. This powerful antioxidant does far more than support your immune system. For people with diabetes, vitamin C plays a direct role in reducing blood sugar, repairing blood vessels, and reversing cellular damage caused by high glucose. Here's how it works. High blood sugar increases oxidative stress and inflammation in the body. This damages your arteries, slows down wound healing, and accelerates aging. Vitamin C acts as a natural shield. It neutralizes free radicals and reduces the stress that leads to diabetic complications. But that's just the beginning. Vitamin C also improves endothelial function. This is the health of the inner lining of your blood vessels. When your endothelium is damaged, blood doesn't flow properly. This can lead to high blood pressure, vision problems, and even diabetic foot. Vitamin C helps relax the arteries, lower blood pressure, and protect against cardiovascular disease. It's one of the few natural compounds that works at the root level of diabetic damage. Now here's something many people don't know. Vitamin C actually competes with glucose to enter your cells. The higher your blood sugar, the harder it is for vitamin C to get in and do its job. That means diabetics often have low cellular levels of vitamin C, even when their diet seems adequate. This is why supplementation is so important. Most experts recommend between 500 to 1,000 milligallons of vitamin C daily for people with diabetes. But some protocols go as high as 2,000 milligallons in divided doses, depending on the severity of the condition. Always consult your healthcare provider. You can also boost your vitamin C intake naturally by eating citrus fruits, bell peppers, strawberries, broccoli, and kiwi. These foods are not only rich in antioxidants, but also low on the glycemic index, making them ideal for blood sugar control. But let's not stop there. Vitamin C has also been shown to reduce the risk of diabetic nephropathy, which is kidney damage caused by high blood sugar over time. It helps filter waste more efficiently and supports healthy kidney function. And if you struggle with slow wound healing or frequent infections, this vitamin is your best ally. Now think about this. Vitamin B6 protects your nerves. Vitamin E shields your heart and eyes. Vitamin C defends your vessels and kidneys. Together, they form a triangle of protection that touches every system damaged by diabetes. They don't just manage symptoms, they rebuild resilience from the inside out. You may be wondering, if these vitamins are so powerful, why aren't they more widely recommended? The answer is that most conventional approaches focus on symptom control through medication. But they often ignore nutritional deficiencies that are silently making everything worse. We're changing that today. You now know exactly which 3 vitamins make a measurable difference in blood sugar stability, nerve health, cardiovascular protection, and more. And here's the best part. These vitamins are safe, accessible, and affordable. They don't require a prescription. They don't have dangerous side effects. And they work with your body instead of forcing it into balance. If you're already taking medication, these nutrients can complement your treatment and reduce your dependency over time. And if you're managing your diabetes naturally, they can give you the missing piece of the puzzle. In the next section, we'll recap everything, and I'll reveal the promised bonus tip that shows you how to boost the effects of these vitamins with one simple change to your daily routine. This tip can help you see results faster, even if you've been stuck for years. So keep watching, because this final piece could be the breakthrough you've been waiting for. You've now discovered how vitamin B6 can help stabilize nerves and energy, how vitamin E can protect your blood vessels, and how vitamin C can strengthen your immune system and reduce insulin resistance. But before we close this video, let's connect the dots and show you how these vitamins can transform your health when combined. If you're struggling with unstable blood sugar, fatigue, nerve pain, or frequent infections, these 3 nutrients can create a powerful defense system inside your body. They don't work in isolation. When you take them together, they support each other's functions. Vitamin C improves the absorption of vitamin E. Vitamin B6 supports how your body uses these antioxidants. It's a team effort inside your cells, and that synergy leads to real results. Many diabetics feel overwhelmed. Between medications, doctor visits, blood tests, and dietary restrictions, it's easy to feel like you've lost control. But what if I told you that supporting your body with targeted vitamins could help you take back that control, naturally and effectively? You don't have to live in fear of complications like neuropathy, blindness, or kidney disease. These are not automatic consequences of diabetes. They happen when blood sugar stays high for too long without the right support. By giving your body the tools it needs, nutrients that reduce inflammation, improve insulin function, and protect blood vessels, you can change your story. Let me share something powerful. Studies have shown that vitamin E can reduce oxidative stress markers in type 2 diabetics significantly. Vitamin C has been linked to improved fasting glucose and A1C levels in controlled trials. And vitamin B6, when combined with magnesium, has shown benefits for nerve function and mental clarity in diabetic patients. This isn't guesswork. It's science-backed, and it's working for thousands. Now, if you're wondering how to get started, it's simple. First, assess your current intake. Are you getting these vitamins from your diet? Foods like spinach, almonds, citrus fruits, and lean meats contain small amounts, but for most diabetics, supplementation is necessary to reach therapeutic levels. Look for supplements that provide the active, bioavailable forms, like pyridoxal 5-phosphate for B6, natural D-alpha tocopherol for vitamin E, and buffered vitamin C for gentle absorption. Also consider timing. Taking these vitamins with food improves absorption. Consistency is key. Daily support leads to long-term improvement. It's not about overnight miracles. It's about building a strong foundation that helps your body heal and stabilize from within. And here's something I promised at the beginning of the video. There's one bonus vitamin that can supercharge your blood sugar control, and that's vitamin D. Most people don't associate vitamin D with diabetes, but the research is clear. Deficiency in vitamin D is linked to insulin resistance, inflammation, and poor glucose regulation. Supplementing with vitamin D3, especially if you have low sun exposure, can be a game changer for your metabolic health. So, to recap, the core trio, B6, E, and C, are essential, and if you want to take it one step further, add vitamin D to complete the puzzle. This combination can improve nerve function, reduce inflammation, support cardiovascular health, and give you the energy and clarity you've been missing. You don't have to fight diabetes alone. There are natural tools, backed by research, that can empower you. Your journey doesn't end with a diagnosis. It begins with understanding your body and giving it what it needs. If you found this video helpful, please take 1 second to click the like button. It tells the algorithm to show it to more people who need it. Comment below with your favorite vitamin-rich food or any questions you have about supplements for diabetes. I read every comment, and your question might be the topic of a future video. And don't forget to subscribe for more science-backed videos on natural blood sugar control, diabetic-friendly nutrition, and powerful health strategies. Now, if you're ready to go deeper and see how thousands are lowering their blood sugar naturally, even after eating carbs or struggling for years, click the link in the description. You'll discover a step-by-step system that works without medications, without extreme diets, and without guesswork. Thousands have already taken back control. Now it's your turn.